Okay, we're good to go? Okay, good morning Queensland. I'm here with Minister Farmer today and our Chief Health Officer, and we're launching the Be Kind at Check-In Time. So this is a great initiative about making sure that we respect our workers who are doing such a great job for us as we go to full capacity at our venues on Friday and bring in the mandatory vaccination for patrons and staff at a range of venues. Before we do that though, I do want to give an update on our cases today. So we've got 6 new cases. These 6 cases are all locally acquired, as in they have travelled from Interstate and have turned up positive in their tests. That will put us at 50 active cases, and we've had 12,326 tests in the last 24 hours and 16,838 vaccinations. And we're seeing a lot of people come forward to get their booster shots. That is fantastic. But don't forget, if you haven't had any vaccinations, we still want you coming out and getting that first dose and getting on that pathway to getting fully vaccinated. Now, in relation to these 6 cases, they are in a number of places across Queensland and have been infectious for up to 6 days. So places such as Gundawindi, Wide Bay, Townsville, Gold Coast and Brisbane South have all reported these cases. In addition, we can report that one of our previously reported overseas positive cases who have arrived from the UK has now been tested positive for Omicron. So that is in hotel quarantine. Now, in relation to 2 of these particular positive cases in the community, we can advise that one person was at the Argyle Hotel in Newcastle, and although in both of these cases we are waiting on the genome sequencing to come back, we are certainly treating them as if they are Omicron. And we know that there has been a large number of cases of patrons who had been at that Argyle Hotel in Newcastle. Secondly, there was the gentleman who flew from Newcastle to Brisbane, then Brisbane to Townsville. This person had attended another exposure site in Newcastle. We are at this stage treating it as if it is Omicron, and it is this gentleman that was on the 2 flights that we put up as exposure sites late yesterday afternoon. Now, in relation to the quarantine requirements for those flights, can I say this? That just as we did with Delta, when a new variant comes along, this is the first domestic flight into Queensland where there is a potential Omicron case on board, that the public health unit acted cautiously to, on the public website, declare anyone on those 2 flights as close contacts, while the public health unit and the Chief Health Officer and our Deputy Chief Health Officers analysed overnight what should be our approach when we do have Omicron on these flights. Do we need to take a different approach in quarantine, or can we apply our normal rules, which is those people sitting immediately around in the 2 rows behind and in front, and of course across, being deemed to be close contacts, and the remainder of them being casuals. So there's been a lot of discussions overnight, and I know that there's been contact with other Chief Health Officers and health officials interstate to see how states are dealing with this based on the national guidelines. So I've been advised this morning that the Chief Health Officer and the deputies have viewed that we can apply the normal rules in relation to these flights, and we don't need to wait until we get the findings of whether it's Omicron, because if it is, we still will apply these rules. That means that other than those people who will be directly advised they are close contacts because they were either part of the travelling party or sitting immediately around this individual, the remainder of the passengers will be deemed to be casual contacts. What that means for those people will be that they have to get tested, isolate until they get a negative result, and then just watch for symptoms over the next 14 days. As I say, we took that same cautious approach when we first started seeing Delta. Omicron's very new, but I welcome the advice of the Chief Health Officer in relation to these issues. Of course, we've also seen a very significant jump in New South Wales cases overnight, 1,360 cases. This is up 804 cases since yesterday, and only 9 days ago New South Wales was down to 208 cases reported. So we are seeing a surge. We are hearing information from overseas, the UK, that Omicron is doubling in numbers every 2 days. And we can expect that Omicron may very well become the dominant variant here in Queensland. Does that change anything? No, because we know whether it's Delta or Omicron, they are both highly infectious, and we know that vaccinations help to reduce you getting sick and you spreading that virus to other people, ending up in hospital and in ICU. So please come out and get vaccinated, get tested if you have any symptoms whatsoever, and please check in. Minister Farmer's got some stats which shows that our check-in data, the last 24 hours we've seen a lot more people checking in. So thank you, Queenslanders, for listening. We need you to check in. Test, check in and vaccinate. That is the clear message. In relation to masks, we ask people to just follow the advice we've been giving all along, no matter where you live in Queensland. Have a mask on you, and if you consider that you cannot keep a reasonable distance from other people in heavily populated areas, you should consider wearing that mask. But otherwise, we just say it's sensible to have a mask on you. I'll now pass over to the Chief Health Officer, and then we'll hear from the Assistant Commissioner, how we're going on the borders and with those border passes, and then to Minister Farmer. Thank you. Dr. Gerard.
Thank you very much, Minister. As expected, now that the borders are open, we are seeing increasing numbers of cases, people coming across the border, and we are seeing cases of COVID-19 across the state. This is exactly what we expected, this is what we've planned for, and that's why we are now allowing this to happen now that we have very widespread vaccination in the community. So just to reaffirm what we've just heard, we've had 6 confirmed cases, all from overseas sources, New South Wales and Victoria, and 5 of those 6 cases have been active in the community. The communities that have been involved are quite widespread: Gundawindi, South Brisbane, Townsville, Gold Coast and Wide Bay. This is exactly what we expected. It is not unexpected at all, and it will continue, and these numbers will increase in coming days and weeks. And as we go forward, we'll probably be reporting this in a different way without going down to so much detail. But at this stage, we're still giving you this detail. So as we've heard, we've had 1 case in Gundawindi who was active in the community from the 8th to the 14th of December. Another in South Brisbane who was linked to the Argyle House outbreak in Newcastle, so likely to be an Omicron case, potentially infectious from the 12th to the 13th of December in the community, although their contacts were quite limited. You were aware of a patient that is diagnosed and is currently in Townsville, who was an aircraft that flew to Townsville, but did not spend significant time in the community in Townsville while there. The Townsville case was also in Newcastle, where we are aware there is a very substantial outbreak of Omicron in Newcastle. This particular individual was not at Argyle House, but certainly we are suspicious that he may well have the Omicron variant, and we are treating him as such. There was a patient in the Gold Coast who was infectious in the community on the 14th of December. That patient arrived from Victoria. A patient in South Brisbane who did not spend time in the community but acquired his infection in New South Wales. And another patient in Wide Bay who was infectious in the community from the 13th to the 15th of December. We still have limited details of that patient. We have 1 confirmed Omicron case in a hotel quarantine that arrived from the United Kingdom. She is well, and she has posed no risk to the community. So, in terms of the Townsville flight, late last night we made the decision, given that this occurred late in the day, that we would immediately quarantine all patients on that flight until we had an opportunity to discuss first among ourselves, the experts within Queensland Health, but in addition with our interstate colleagues, how best to deal with the passengers on this flight. We took an extremely cautious approach. This is the first domestic flight on which Omicron, a likely Omicron case has been diagnosed. But moving forward, following these discussions, we believe it will be safe to use our more usual infection control measures, whereby we isolate or we quarantine those people 2 rows in front of and behind the passenger involved, even if it is an Omicron, as we expect. As I've said, this virus is going to continue to spread. It is very clear now that Omicron is very contagious, and most of us now believe that the speed with which we will reach a peak is probably faster than we originally anticipated. I think it's probably, we're talking more in the weeks than the months. From what we're seeing in New South Wales and in the United Kingdom, it's very much faster and it's much more contagious than what we've seen previously with Delta. So we'll be seeing that in the coming days and weeks, and I think we can reasonably expect that Omicron will spread in Queensland in the coming weeks. It won't be a surprise. We are not going to change our plans as a result of that. The main thing, of course, is to get vaccinated. If you've had your 2 doses of vaccine within the last 5 months, the evidence suggests that you will have good antibody response and you'll be immune, particularly against severe disease. It's early data, so there'll be more information from human data in the coming weeks and months. Most of what we have at this stage is still from the laboratory. If your vaccination was greater than 5 months ago, then it's important that you get a booster. We know when you get a booster, your levels of antibodies climb dramatically. So when you get that 3rd dose, you get a dramatic increase in your antibody levels, which will give you good protection against the Omicron strain, we believe, and that the international community believes, in the coming months, particularly against severe disease. And that's really what we're talking about, preventing severe disease. The fact that we're seeing some patients who are vaccinated getting COVID and getting Omicron, that's not a surprise at all. The patients that I've seen and I've been talking with some of the doctors looking after these patients, the patients we know, I'm aware of have all had mild illness, and particularly those who've been vaccinated. But getting infected, if you are vaccinated, is not unusual, it's not unexpected. The main thing we're protected against with vaccination is severe disease, and we believe that the vaccines that we are using will be effective.
Thank you, Minister. As expected, we're seeing high volumes of people travelling across the borders. In the last 24 hours, police have checked 25,000 vehicles at our road borders. We're still seeing people arrive at the road borders without the appropriate passes, and we ask people to, if they can, please get the appropriate pass. Delays at the road borders at peak times are up to 30 minutes, but generally speaking, they're less than 10 minutes. At our air borders, we've checked 5,000 people, and I've also been asked to remind people at our air borders that masks are still mandatory in the domestic terminals, if people would please wear their masks in the terminals when they're meeting their loved ones at the domestic airport. In terms of our border pass system, it's currently operating well. We have 51,000 applications for domestic travellers to come across the borders. We have 440 applications for international people to quarantine at home.
Well, from this Friday, it's a very big day for hospitality and entertainment venues, because it will be the first time for many of them in 18 months that they've been able to operate at 100% capacity. We know many of these businesses have really borne the brunt of the COVID restrictions. We've got borders open, we've got families reuniting, we've got Christmas just around the corner. It is what we have all been waiting for, and Queenslanders are safe. We've got businesses open and trading, and in many other states and territories, they're fighting to keep their freedoms. we are fighting to hang on to ours in Queensland, which is why from this Friday we will be asking staff and patrons at hotels, pubs and clubs and cafes to show proof of vaccination. And we are asking Queenslanders to please do the right thing from this Friday. This is a new normal for many of these businesses, so please do the right thing while the businesses get into the swing of this new regime. It's why today we are going to the airwaves and social media and shop fronts, and we're asking Queenslanders to be kind at check-in time. So please, when you go into these venues on Friday, from Friday, if a business owner or their staff asks for proof of vaccination, please show them respect. They are really just trying to do the right thing. We know if you choose to not be vaccinated, then that is your decision, but it does not give you the right to abuse staff who are really just trying to do their job. And we know this is an issue that many businesses are really concerned about. So please do the right thing. Businesses will have signage at the front of their premises making it really clear about the vaccination status of their patrons. Please look at that sign and make the right decision. But if you go into that premises, please don't wait to be fined. Please don't wait to be asked to leave. Please don't wait for the police to be called. We don't want small business owners to be the police. We just want Queenslanders to be kind. However, penalties do apply. Under the Public Health Directive, if you cough or sneeze or spit deliberately at a staff member in one of these premises, if you refuse to leave the premises, then penalties do apply, and business owners are well within their rights to call the police. We do not want them to be the police themselves. So this is what COVID looks like on our terms. We want businesses to be open, and it is so good that so many of them will now be able to operate at full capacity. So that's the message. Please be kind at check-in time. I want to introduce Jimmy Young, who's the owner of Milton Commons here, who is really looking forward to Friday.
Hey guys, how you doing? Welcome to Milton Common. We're a small microbrewery bar and restaurant. We opened about 4 months before COVID hit, so we're one of those businesses that's adapted and evolved throughout the last 18 months. So this Friday is going to be a good day for us as well, so we can hit the ground running in the new year. A few things around the community here. Everyone's checking in anyway, so the feedback we're getting is really positive. We haven't had much backlash at all, and then we'll manage things as we move forward.
Are you a little bit worried about what's going to happen?
Not really.
What the Minister said, if you do get people in here that refuse to leave?
Yeah, well, especially after a couple of skeweries, it's been a hot topic recently, and the feedback's been positive as well. And we're such a highly legislated industry anyway, that we're used to that sort of stuff as well. But we're highly governed, so we're treating it like anything like OLGR or council, so we've got the management in place to be able to deal with it.
What about with your staff? Have you told them that if they are in close contact, and you know the rules of what you've got to do?
Yeah, well, that's something that we'll deal with when we come to it. Yeah, we will.
Is it a little bit nerve-wracking though to think that if you do get a case in here that it could cost you an extreme amount, a lot of loss in your business?
A little bit. I guess like over the last 18 months, things happen up and down, so we just adapt to what happens at that time. So we'll see.
But practically, how do you think you'll run it? Will you ask people's vaccination status when they come to the door?
Well, having it linked to the check-in app's really good for us because it comes up as that green tick. It makes it really easy. Most people walk in showing us anyway, so we'll have it out the door. In the busy periods, might have somebody on the door doing it, but generally, it'll just be behind the bar. Awesome, thank you.
Minister, what changed in terms of going from close contacts to casual contacts? Was it the advice from Dr. Gerard or...
Yeah, absolutely. You know, sometimes you'll see exposure sites going up, and those exposure sites may sometimes initially say that everyone who has been to that site is a close contact, and then you'll see that modified as the hours go on and the opportunity to evaluate the level of risk. We will change that down to casual contacts. So this is a similar situation. This is the first time we've had a possible Omicron case on a domestic flight into Queensland. So I recall we did this when we had our first Delta case on a flight, that we went from just asking the people immediately seated around the positive case to actually asking the whole flight to quarantine just for a short period of time while we could assess the risk. That's what happened last night. We just wanted to assess the risk. Now, we had two options. We could have waited to see what the genomic sequencing showed as is it Omicron, and then do we treat it differently? But my request this morning to the Chief Health Officer is, even if it is Omicron, and let's assume it is, what should the rules be going forward? So everyone knows, irrespective of which variant it is, what's the rules around quarantine on flights. And based on phone calls I know that happened this morning across health officials in other jurisdictions, the advice given to me is we can take that level of comfort that we can allow most passengers to be deemed to be casual contacts, which I think is great news, because those people mean that they can go off, get their test, isolate, get their negative result and get on with enjoying their Christmas plans.
It's a protection measure, yes, Minister, but can you see how people are frustrated, considering that if I'm up the front of the plane and they're right down at the back of the plane, I probably won't go anywhere near this person, and then I've been told that, yesterday, I know it's changed, but yesterday they would have been furious.
Well, none of them had been contacted by the contact tracing team yet. It was just what we put on our website as our initial advice. And the Public Health Unit always takes a cautious approach. When they first put sites up, they often will broaden, whether it's a casual or close contact, and then as more information comes in. Omicron is so new that we needed to assess, and Delta we did the same thing. Even though it might be someone at the other end of the plane, they might have passed each other on the way to the bathroom. They might have stood near each other on the way to, waiting for the bathroom. And I know flights do an amazing job telling people not to line up in the aisles now while you're waiting for the bathrooms, but all of those things to occur. So we just needed to get the advice. Are we comfortable with the level of risk of exposure if it is Omicron? Because we're seeing how quickly it's spreading, and I welcome the advice that we believe we can keep the risk level exactly the same as we have with Delta, which is only those people immediately seated around that person will deemed be close contacts, and of course anyone travelling in their party will be deemed
So
close
you mentioned
contacts.
that you deemed it all close contacts to buy yourself time to discuss.
The Public Health Unit did last night, yes.
Are you seriously suggesting you hadn't previously discussed the likelihood of an Omicron case arriving by plane?
Things have moved so quickly with Omicron. We're still getting information. There is new information coming out overnight. So there is new information internationally about Omicron, how infectious it is, the risk of illness in relation to that. We're seeing new information in the last 48 hours about the rate of infection in the UK. So there's so much new information coming out. If you're asking why did we not assess 2 weeks ago how we'd deal with Omicron on a plane, we didn't know this much information about Omicron 2 weeks ago.
A couple of days ago?
Oh, we still, I think have moved pretty rapidly in a matter of hours. And it's not just a plane. Sometimes we deem, individual sites as close contacts until we have time to analyse, because the Public Health Unit would rather take that approach and move back and go, actually, we can now say the majority of people, other than the ones who went to this store and this store only between this hour and that hour, are now deemed close contacts, and the rest are casual. We do that, and the Public Health Unit adapt those rules all the time on our website based on more information. So
Early on in the pandemic, we changed the rules whereby a phone number had to be attached to all domestic tickets. Previously, it was just an email. You changed it, so now everyone who gets on a domestic flight has to provide a phone number for contact tracing purposes. So why not contact those people and say, sit tight while we assess this? Because by going public with all planes, reputationally, that's a disaster. Is it not?
Well, no, because we have taken this approach all along, which is our public health team act very quickly to put up exposure sites. We have done this from day one because we want the public to know as soon as possible that you are possibly at risk, you have been exposed to the virus. You have been on a plane, you have been at an airport that has had someone positive with the virus. And we have always acted quickly to put those exposure sites up, and then we have worked through the information and we have adapted what is a close and a casual contact as more information has become available. So it is not unusual for us to put up at this airport on this day, these people have to go get tested, and then we step back from there and go, actually it's only people who have been at that gate and everyone else isn't even a casual. They are low risk contact, don't need to even get tested, they just need to watch symptoms. We've done this all the way through. I'd rather that than the public health unit said last night, nothing to see here, and then 24 hours later go, oh, actually, we have a whole lot of people at risk and we haven't told them for 24 hours. So I'd much rather start there and move back than the other way around.
Out there? There's 424 cases in New England today. Will you shut Newcastle out? Or will you lock Newcastle out?
There is no recommendation at this stage to do anything more. Remember, the whole of New South Wales is deemed a hotspot.
Yeah, but there's
the whole of New South Wales.
Cases, Minister, in the New England area.
Yeah.
And we're talking about what could quite possibly be the biggest Omicron spreader in the world. And at this stage, the advice is not to close.
At this stage, there isn't the recommendation. The public health unit and the chief health officer, they watch this every minute, not just every hour and every day, every minute.
It'd be on the back of your mind, though, sure.
Look, we have to look at all scenarios, but we have not made any changes to our plan. Why? Because every single person we are allowing to come into Queensland right now from New South Wales, whether it's Newcastle or anywhere else in New South Wales or Victoria or the ACT or Greater Adelaide for that matter, have to be fully vaccinated, have to have had at least 1 week since they had their second vaccination, and have to have a negative PCR test. We know that reduces the risk. Even though we're getting positive cases, as Dr. Gerard said, we are not seeing any one of these cases seriously unwell. Not one of these cases are ending up in ICU. That's what we're planned for. By only allowing fully vaccinated people who have already had a negative test, which means their virus has only been picked up in the last 2-3 days, means we're reducing the risk for the community. So that's where we're sitting at the moment. We'll continue to monitor. I will continue to watch what New South Wales are doing and whether they change any of their settings as well.
Do you think it's to undermine the confidence of travellers coming to Queensland now? I mean, how can anyone book a holiday?
No, because I'm standing here today saying that the Chief Health Officer and the Public Health Unit have advised that all future flights, whether it's Omicron or Delta, that it will only be those people sitting immediately around the positive case who will need to be deemed close contacts.
So there are no circumstances in which an entire plane would be deemed close contact, regardless of the movement of the person on that plane, whether at the front or the back. You're saying that there will be no cases where an entire plane...
I'm never going to say never. It could be a flight attendant. If a flight attendant turns up with Omicron and have gone back and forth and waited on everyone, that might be a different situation. I'm not going to deal with hypotheticals. What I'm saying is I'm very grateful that the public health advice is that we don't need to treat Omicron any different to we treat Delta when it comes to plane flights at this stage.
Minister, you're obviously...
But then are people just playing Russian roulette when they choose to fly into the state?
Not at all. I've just made it very clear.
Minister, you're obviously still telling people to get their first dose, but it's the
Yes.
vulnerable Queenslanders that are due now for their booster.
Yeah.
Are they at risk? What numbers do we have of people coming out to get that
Look,
booster
what
shot?
I know, and I said what our vaccination rates, I think it's gone up like 6,000 in the last 24 hours. What I know is a large number of people who are coming out getting vaccinated at the moment are for boosters. Strongly encourage it. All of the evidence we're getting so far on Omicron is that that booster is so important. So I do encourage anyone who's eligible to come forward. Our pharmacies are providing it and our GPs are providing it and our state vaccination and Commonwealth clinics are providing a booster shot. So please don't wait. I am interested in hearing from the Commonwealth the rollout for boosters in aged care. Remember, our aged care facilities were the first ones to get the vaccination at the start of this year. They are the most vulnerable, and we know that they're most at risk if Omicron gets into those residential aged care facilities. So I am really keen to hear from the Commonwealth just what the rollout plan is to get those boosters into those aged care facilities as quickly as possible.
Minister, have you checked Scott Morrison's negative test? You know he's in town, obviously. You'll be going out for lunch with him, surely.
I'm confident, I haven't got an invitation for lunch, but I'm confident the Prime Minister would be accurately reporting his negative test.
What's your plan for boosters in Queensland Health? Minister, are you going to plan to roll that out to frontline staff?
So we will make sure everyone who's eligible is going out and getting vaccinated. We already still provide facilities for staff to get vaccinated on site, but of course, our health workers can go to any one of our sites, our vaccination clinics, as well as GPs and pharmacies as well. So, our health workers know better than anyone the importance of getting that booster and being fully vaccinated, because they know what's coming. They know that, as we just heard, we're likely to see that surge sooner than what we had planned and what has been modelled, because all of the modelling we had was not based on Omicron.
These 6 cases that were interstate of origin, have they all been adhering to the rules to get in, particularly, I guess, the New South Wales case?
There's a couple that I want to get more information on, because of the fact that at least one of those people came by road and before Monday. So I do, every single one of the cases we mentioned today are fully vaccinated. So that's great. They have complied with being fully vaccinated, but I just want to check what pass they had and whether they all had negative tests before they arrived.
Just to double check, Minister, you'll update those plane passengers the advice on the Queensland.
Absolutely. I understand the contact tracing team will be contacting everyone on the flight.
And also, you probably don't know this, the tweet that's been sent out this morning actually suggests there's no new locally acquired cases here in Queensland. It says 6 under the other column is...
Oh, so... We're getting more and more. We're getting more and more. I think I'm going to start saying domestic and international versus locally acquired, because what we have is these cases have been in the community and are positive, but they've actually contracted the virus interstate. So we put that in the other category, because thankfully, despite all the cases that we've been reporting in recent days, none of these people have contracted it in Queensland. They've all got it interstate and come in. So that's why we're classing them, that's why we're calling them others, yeah.
Last question. How do you know that?
Because the amazing work of our team are able to trace it back to New South Wales origins. And can I say, with our contact tracing team, every one of those people reported where they've come from. So every one of those people have either come from Victoria or New South Wales in recent times.
Why isn't the Premier in
I often do the health report without the Premier. The Premier has full confidence in me in giving the COVID updates, so this is not unusual. Pardon?
You get paid extra?
I get paid fine.
Very last one now, thank you.
I'm just interested, we talk about a lot of information coming on Omicron every day. People are on the internet all the time, there's new studies. I think there was one reported overnight out of South Africa, real world data that suggested that 2 doses does provide you with a degree of protection against Omicron.
Yep.
How much of it, what's your understanding at the moment of what the thing does and its transmissibility?
In terms of, can you repeat the question again, please?
So there's a lot of information online, obviously, about how transmissible it is, how dangerous it is, whether it's mild. From Queensland Health perspective, what is it you understand about it?
Okay, what we understand that it is clearly very transmissible, more transmissible than the previous variants, and therefore that the speed with which the epidemic will spread will be faster, we believe that. The evidence from the laboratory particularly suggests that with 2 doses, particularly of vaccine, particularly within those first 5 to 6 months, you get good neutralising antibodies, which correlates with a good immune response in real humans, and that a 3rd dose of vaccine gives you a very major boost in antibody response. Now, what we need to see in reality is real human data. That takes longer, of course, because we need to see real people. How many people get admitted to hospital if they have Omicron and are vaccinated or are not vaccinated? We don't have all that information yet. We're not seeing huge numbers of admissions or deaths from the Omicron strain in the UK or South Africa yet, but we know those are lagging. Those are lagging indicators, because it takes a few weeks before we see that. It is a little bit promising, but I don't want to pin too much hope to it.
Given the Townsville passenger obviously might have contracted it after the 72-hour PCR test before leaving, would you consider shortening that window for the test before they fly?
It's just not practical. I mean, as time goes forward, we have to have some degree of risk appetite. We can't just completely lock down and eliminate all risk. That's no longer possible. And realistically, we expect that this virus will spread in the next few, probably weeks, even just a few months. What we know is if we reduce the number of seeding events or spot fires, if we keep those down, the rate at which it climbs will reduce. And that's important, very important, because it reduces the load on hospitals. And that of course, is the greatest concern. If we get a very big surge too quickly, the risk is on on the hospitals.
Thanks, guys. We're going to go.
Can we get one off topic? Just a quick one off topic to the Minister. Just on, there's obviously, Minister, it's not in your portfolio, but just one quick one if I can. Just on the dam levels, we had that big rain here. We didn't get a lot of it out there. Are you worried, or is the government worried that the population here in Queensland is going to outgrow our water supplies?
We're always planning for population growth, and I know the Premier welcomes the number of people who have all decided in recent weeks and months to call Queensland home, and we see them flooding over our borders right now to call Queensland home. So, you know, we're always looking at what our infrastructure needs are going forward, and, you know, as much that rain has been difficult. We've seen flash floodings and sadly we've seen loss of life, but I know that has contributed to some of the dams as well, which has been certainly welcomed in some of those towns. And I should say with the question with the Premier, she's been certainly busy this morning on calls to me and chairing our COVID briefing this morning, because this is important issues and we continue to have these briefings every single day. So thank you, get vaccinated, get tested and check in. Thanks.
The PM on white to research hall. No, I know, that was Shannon Marshall.